Welcome, my name is Dr. Patrick Flynn, and today we're going to cover the fireman and carpenter principle. It was always very frustrating for me when people would say, well, what kind of doctor are you? What do you do? So I had to really start to create some analogies to be able to have a discussion with them so when they left, they know what my role was in their life. If we look at the forms of healthcare, if we look at it, there's kind of like medicine, and there's kind of like some natural medicine. There's medical doctors who do things with a bunch of drugs, and there's people that do a bunch of natural things. And so there seems like they're a competing entity. Well, they're actually not. And I think the fire department and carpenter principle really actually gives them a clear distinction of what their role is, but also what the patient will need and who they can use to help them achieve what they want. So if we have the analogy of you have a fire, some major disease, but when you look at maintaining and actually repairing, and even repairing some of the destruction that was done through that process, you need a wellness way doctor, because their carpenter viewpoint is going to look at the body, they're going to test them properly and say, here's what this body needs. Here's what we can do to get it back to normal. Because I want people to understand that the fire department doctors, their drugs and surgery, their axes and hoses are very necessary to handle some of those major situations. But on the flip side, the things that we do, the approach, the testing, the things that we do for people, and actually what they need to take and rebuild their body is essential for them from that carpenter standpoint. But the biggest point I want you guys to understand, they're two different perspectives using the same body. And that's the difference between health and disease. A carpenter will deal more with health, and the fire department, the medical field, will deal with more disease. If you came to a wellness way practitioner for a major heart surgery, we don't have the expertise or understanding to do that. Vice versa, if you go to the basic medical doctor or even a surgeon and ask them how to be healthy, that's not their world, and they have no idea what to do. And that's okay saying that, because the example, the principle, the analogy really gives people, the people out there, you guys, some guidance on what practitioner to use. When I started to actually share this principle, other doctors of all professions started to use it because it really started to bring some clarity about how to describe what people are doing in their practices. In society today, which you'll notice, we are dominant in the fireman thinking. We are told that that's what we need. You can see that from when you're young on. You may start with a pediatrician, might end up with a general practitioner. If you're a woman, you might end up with an OB. All those doctors could be very essential. But what happens is they're from the fireman thinking. We need both. You need a carpenter thinking because it's dramatically different than the fireman thinking. Imagine that you got to a carpenter doctor when you were younger. I believe that there would be less chance of you needing a fire department doctor as you got older. Because if you can maintain and take care of the house, you'd be surprised how little fires it will have in the future. One of the easiest things that you can do is go to the Wellness Way website, click on Find a Clinic, and actually go search out one of the talks where you can see this full analogy in its entirety. To learn more, you can sign up for our newsletter, you can watch a different perspective show, or you can go to our website to find more information. All right, I heard that there was a little technical difficulty, so we're gonna start the show over just like from the beginning, and we just won't replay that video, but because we do put this up on our website in a new format, so I'm gonna start like I actually am starting all over again. So here we go. I'm gonna do a little sip of my drink. All right. Good morning, everybody. My name is Dr. Patrick Flynn, and welcome to this morning's A Different Perspective. I am so excited you guys are here with me today. It's been a great day. I want to start by saying happy birthday to my beautiful mother. It's her birthday. She is 68 years old. Yes, it was kind of cool. My mom had me when she was 20 years old, and it was great because I could imagine what my mom was thinking when all of a sudden she had me, and I wondered that she ever predicted the things that we are doing today. I can see my mom on a daily basis because she's always working here with us. It's great having her here and seeing my mother on a daily basis. And but happy birthday, Mom. We love you. We'll definitely see you later. We're excited to hang out with you. I wouldn't be here, obviously, without you. You're a big part of who I am today, so thank you so much and everything for all that you've done for me through the years and everything. So happy birthday, Mom. We do love you. Her name is Linda. Please say happy birthday to my mother there. And that being said, there's so many special people in our life, and we have so many great things, and I want to bring up somebody that you guys hear me talk about on a regular basis. You ask, who is he, stuff that was put a face and name. So coming up, Dr. Devin, my future son-in-law and stuff, and he is here for the weekend, and he's coming today. Remember, if you're down in the Penn School office, here he is and stuff. You can see that pretty face and some of that, so it's kind of funny. That California, that's not a joke. I actually, when I first met him, I thought he was from California. He looked like a California beach boy, blonde and also that. And I was like, and actually, he's from North Dakota. So it's kind of cool. So, but also want to say hi to your wonderful mom and some of that. So good morning and everything. So yes, but he's here, spending a great weekend with us, and we're going to do some amazing wedding planning that we have in February. So excited to, as a dad, you always, you see some terrible things happen with women and stuff of that, and it's like, oh my goodness, I mean by that, it's like they marry some crazy guys and stuff of that. And as a dad, I've prayed every day that my daughters meet an incredible man and build a life with them, and I'll happily send them off to one thing. So I couldn't have asked for anything better. It was almost like it was a dream come true for me, for a guy like this to marry my oldest daughter. So, all right, man, I love you. Thanks for being here. So it's great having him stand next to me as a father-in-law, future father-in-law, but watch him take care of my daughter, and it's going to be absolutely incredible. And as Faith goes off to chiropractic school, and actually I'm excited for their future, to what they have in store, because they will accomplish much more than I ever have and stuff that I'm hoping to set them up so they can have a beautiful future together, and all my daughters that way. So it's kind of exciting. So yeah, it's going to be a fun day. That being said, like I said, amazing people. We always have incredible interns that you guys have met before, but we have a very special intern that was also the president of our Northwestern Club. So Dr. Hunter coming up, I'm going to have him share a little about this, and I want to say hi to his wonderful, beautiful wife, Abby. Good morning. I hope you're doing well. I want you to put your hand on that baby bump and tell the baby that Dr. Patrick can't wait to see you. So, Dr. Hunter, tell everybody about yourself a little bit.
Like I said, I'm Dr. Hunter. I'm from Bismarck, North Dakota. I went to Northwestern Health Sciences for chiropractic school. We've been patients of the Wellness Way for many years, and the Wellness Way has given us a beautiful life and a life together, and we just are so thankful for it.
Yep, and I want to say special thanks to Dr. Steve. He introduced you that way, so it's kind of nice, and one of the great docs that actually led him to even find us that way. But he had him in school. He trained hard. He still trains hard. 2 days ago, he was sitting with a stool test and going over some labs with me and stuff, and the great detail. And that's why these guys are here, and all of our great interns are always here training, doing stuff. So, Doc, we're always happy you're here. Excited for it. It's awesome. So. Amazing people, amazing things happening. And if you want to keep up to date on all things happening here, across offices, across the world, and everything we're doing, please do me a favor, go to our website, sign up for the newsletter, as you can see right here. It's quite incredible. Our website actually has so many great things on there that you can see on a regular basis. And on top of it, the reason what you see at our website is the Find the Clinic. There are so many people that are actually always looking for Find the Clinic. They see the video, you can type in a location. We have places all over the world. It's exciting to see offices like Dr. Hunter will eventually be back in Bismarck, going there. As you know, Dr. Evans in Pensacola, you can see his office. We have all of our interns that are going to be in offices all over the world. Also, I want to say hi to Dr. Patrick. As you know, he was our intern, and he started here, and they had the intern now in Mequon. But we do miss you. It's like sending off your kids off to another place, but he is very missed, and we thank you, Dr. Patrick, for being with us, because we have a change in our plans today. A change in our plans. We've gotten so many requests, I can honestly tell you. We had about 300 messages even last 2 days on Instagram, plus all the emails, plus everything. And we always like to listen to you guys' requests. And you said, listen, Doc, we love when you teach. It's great. And we love question and answer. We have a bunch more questions. We'd be willing to do one again. I said, absolutely. But this time, because I do them on a regular basis, I wanted to bring the one and only Nicole Selesky with me. So what we're going to do now is this. We're going to move into our perspective, and then we're going to first show, we have our intern, future Dr. Jenny here. Dr. Jenny is over there. She can wave to everybody and everything. Travis will put her up there for a second. And you can see Dr. Jenny hanging out over there. There she is. So she's going to be asking questions. And I said that's why I wanted to say hi to Dr. Patrick, because he actually did it for them. And now we have Dr. Jenny doing it. So we're going to fire some questions. So we're now going to move into our perspective. Morning.
Hey, good morning.
So you had a little bit, why don't you tell everybody before we get started Q&A, why don't you tell what you've been doing over the last couple of days and hundreds of students? And
just got back Thursday morning. We went on a tour to several different chiropractic colleges that wrapped up the 5th chiropractic college I've spoken at in the last month, but we just did 3 in a row. We were at Palmer, Florida. We did Life in Atlanta, and then we did Palmer Davenport as well. We were able to speak to over 300 students about birth control and women's hormones, and we laughed, we cried. I got really angry and I jumped up and down and threatened to take all their IUDs out. It was pretty amazing, but I think we got them to have a different perspective, and it was a lot of fun.
Yes, yeah, and can't thank you enough for students for doing that. And if you've never heard our birth control talk, guys, it's incredible. I think we should do a little bit online so they can see can have her perspective on it. Coming from a medical field and understand birth control the way she does, it's a great talk, and it's a great talk for all of our docs and future docs to see. So what we're gonna do is this: we have a ton of questions, and what's gonna happen is this: I just popped online. If you want to get one done live, type in the email to askdrpatrick@thewellnessway.com. So askdrpatrick@thewellnessway.com. Dr. Jenny has a bunch of questions already. We have the other interns and people watching Facebook, YouTube, and everything we're live on now. But you can ask specific to Nicole herself. Remember, I don't care if you ask Nicole every question. I can just sit here and smile. So it's kind of great. But I've done this all the time. So we can go through the questions. So Dr. Jenny, are you ready?
I'm ready.
All right. So why don't you start with the first question?
Awesome. So the first question today is, what is the best way to biologically and nutritionally support a 16-year-old boy as he goes through hormonal changes?
All right. You want to start with that one?
I suppose.
Yeah.
So what can we do to support a boy that's going through hormonal changes? Well, so regardless of if it's a boy or a girl, I think it's kind of the same thing, right? So you're going from having very little hormone to all of a sudden having hormone for the first time in your life. And so for whether it's a boy that has to go through all that scratchy voice kind of stuff, right, as his voice deepens, or a woman who is now starting to get her period and breast buds, we got to start to think about, the hormones are always the end domino to fall in an inflammatory process, right? So if there's stuff going on within their gut, if there's stuff that they have food allergies, if they have some of those things, that they're already in an inflamed environment, and hormones are nothing more but chemical messengers. So they're there to try to send signals on how to heal and repair the body, and they go from having little to having a lot. So sometimes those chemical messengers can make people feel, I don't know, kind of crazy, or having some brain fog issues, or having different mood swings and different things like that, because they just don't know how to handle all this hormone that they now have. And so preparing a girl or a boy to go through that puberty really is just as simple as figuring out how to have them be as least inflamed as possible, right? Like getting rid of food allergies, getting rid of processed foods, really supporting the body well, because all of a sudden having hormone is a normal biological process. There's nothing extra you have to do. But a lot of times we're the ones that screw it up and inflame our bodies that make that transition a little bit more difficult. Yep.
And see, that's always the key. If you ever go back to our perspective, if you look at the way medical field does it, and actually she can do this. She could take a 16-year-old boy, which we've seen low testosterone, and she could give him testosterone injections. But like I said, it's a compensatory thing for a loss of hormone from just chronic inflammation. The nice thing is 16-year-olds, it's not a common thing, but we've seen it. We've seen low testosterone in teenagers that way. But then once you actually reduce that whole inflammation, which is still the key, then support it. We need cholesterol, so we need a good liver function. So keep that young boy away from as much sugar as possible. Give him oysters. Sam, and you can take it in the form of a pill form. Like I said, I take our male glandular. We have the thing about oysters. There's a ton of zinc in them. It's important for it. You want to make sure that his liver's staying good. So watch the sugar. You can actually even give him things like milk thistle to help a little bit of clearing out the liver, which once again, good hormone conversion that way, but also production, so that when you actually have the inflammatory response low, which is still the key. Remember, don't just go take a ton of zinc for a 16-year-old boy. Actually make sure that inflammation markers get down first, reduce his sugar, and guess what happens? Then you can do supportive things like using some trace minerals and things like that, like zinc and other things that will actually support that. So remember, always come from our perspective that if all you do is supplement something chronically ill, you're not going to get it back normal. And on top of it, that supplement won't work over time. So, what we got, Dr. Jenny?
Awesome. Next we have, what do you think of apple cider vinegar gummies, and are they healthy at all?
I think that determines on the ingredients.
I think it depends. I think there's probably some good products out there.
Yeah, so do I. That's saying it just depends on the ingredients, because I've seen great apple cider vinegar gummies, because we understand that kids, it's hard. I guarantee they're asking for their children how you get apple cider vinegar into them.
I mean, I wouldn't be so sure. There could be a 40-year-old woman that just really doesn't want to choke it down.
That's good.
You know, you never know.
Yep.
But you're right. So I think it comes down to, like you said, the ingredients.
Yep.
I mean, like there really shouldn't be a whole lot, and
Maybe
you should be able to
collagen.
read them.
Yeah, collagen. So that if they have added sugar and stuff like that, don't do that. It's not worth the sugar. You kind of negate the aspect of vinegar that way and stuff. So yeah, I would say that get a good organic product. Make sure the ingredients are really small and stuff like that. And I think I would have no problem with apple cider vinegar gummies. All right.
All right, so we're actually already getting questions about Nicole here, so it's fun to have you here today. Someone asked, Nicole, how has your medical colleagues treated you since you are on the polar opposite side of care from standard medical management?
Ooh, good question.
How have my medical colleagues? My medical colleagues. Let's be honest, you either love me or you hate me. There's really no in between.
That is true.
And I've had to learn that. I know, okay, so when Patrick and I first started going live during the pandemic, I think was the first time that I actually had death threats in my inbox.
Yep. It's not a joke, guys. I have to pause you on that. That's not a joke.
No, it's not a joke.
That's not a joke. There's people that call up our practitioners and threaten them, or we've had to call the police. That happens here. So when she talks about that, I know she's smiling, but what happens this, because we've been through it that way, we're kind of used to it now. When that first happened, that was devastating to her. This is, so by her even stepping out saying, listen, now we're going to talk about the last 10%, looks how it shifted. We were right from the start. We always knew we were, but that was actually true. And it's very sad this comes up that way, but go on.
Yeah, no, I had several like stalkers or people that had multiple profiles that kept harassing me. That, you know, it was, I mean, it's awful, right? So again, you either love me or you hate me. Now, I've actually had medical professionals reach out, especially recently an oncologist reach out, because he realized that the patients that he had that I also had care under were doing better because they were more supportive. And he said, what is it that you're doing over there? So I think that there's people that are curious, but there's a lot of people that think I'm a quack. I mean, let's just be honest. They think, oh my goodness, like there's no way, like, I don't know. I think I've had a lot of disrespect and I've lost a lot of friends and a lot of people within the community for sure, because I went the other way with the wellness way. And then I've also had nurses that I was working with in labor and delivery go through the Wellness Way Academy, love everything we have to do, and want to do more of it. So it's just, you know, it just depends on, are you open to a different perspective? Are you open to thinking that maybe it's okay that we have firemen and carpenters?
That's what I was saying. Look at the video we just produced. You know, she actually has a wonderful ability to actually, all of a sudden, if someone comes in where we recognize that they need the fire department, well, guess what happens? Nicole happens to be in a situation where it's like, don't have to send them there, she can just do it herself.
Yeah.
But so she lives the majority, 99% of her life within that carpenter viewpoint. But because she actually has the ability to work in some of the fire department situation, if somebody needs surgery, we're sending them up to the hospital and things like that. But so it gives it, so that's why we want her medical colleagues to look at, going, we respect that medical viewpoint, but we just have a carpenter viewpoint. Yeah. And it's kind of nice. So that's where
I'm not here to replace you. I just do different things.
Yeah, that's it. Different perspective, different way of care. Remember, go back to that video. That's why our team is producing videos like we just shot there, that little 3-minute, talking about you need the fire department if something comes up. And so, and trust me, personally, I know it does come up every once in a while. Yeah. You say, and that's okay. So,
and I still send patients to the regular regular world,
physician,
you know, the Western world when they need a little bit of a workup of like some imaging or something I can't provide for them. And I think it can be a very beautiful combination, but I think that you gotta get past your ego to understand that.
And I think that the things that we do with cancer in the future, it's going to be even more of a synergistic aspect, because you know, I've looked at some person's labs and they're like, I don't want to go through surgery. I'm like, that tumor is growing fast. You don't have any choice, you say, and stuff. And that's so we recognize that. I think that we want to do over time is we want the medical field to recognize, saying, listen, you know, you don't have to dive into all that stuff right away. You say, especially because there can be major negative side effects, as there is a different perspective. And like I said, we just keep getting bigger and people keep reaching out. Just like you were on the phone with me the other day. I was on the phone, but I was with you that way. There's another nurse that wants to go through academy because of her own health journey, and her own medical field was failing her. And so she started to look at our perspective and got some great change, and now she wanted to add it to her protocol. So it's kind of nice.
You know, most people have cancer for 8 to 10 years before they ever have a diagnosis. And so when they're in my office, our office, what we're trying to do is try to figure out how do we change that environment within the body, the terrain to not create cancer in the future. It's a completely different. That to me, friends, is true prevention.
Yep.
Not taking your breast and putting it like a pancake in between two radioactive plates, trying to find a tumor. That is not prevention. Prevention is being able to test the immune system, balance the hormones, do all that stuff ahead of time, so that you are not going to be one in the 1 in 2 men or 1 in 3 women that will get a cancer diagnosis in your lifetime.
Yeah,
Very
and just
different.
think about that. That's true statistics. 1 out of 2 and 1 out of 3. That should scare the heck out of you. You understand? It shouldn't scare the heck out of you that you should be worried about your future. You should actually do something so your future is different that way. So, all right, Dr. Jenny, what do we got?
Next up, we have, what are your thoughts now that the CDC has changed its position on COVID-19, the vaccine, and now looking into Fauci?
Well, that's our last 10%, but here's what happened this. Nicole and I, she started at the beginning. We sat down and said, listen, we needed to do a CDC update every week. And we sat there and we read stuff and we're going, they're lying to us. Go back to our past videos. Actually, no joke, it's what got us kicked off of Facebook and everything. But we went through and we just saw the perpetual lies and things like that were coming out, and we reported them. So
Our perspective has never changed.
never. That's the
Since
thing.
day one.
Has not changed. You're saying so. We'll cover in the last 10%, but I think both of us sat here for 2 years just frustrated. But not frustrated, not doing anything. Frustrated, keep on putting our message out there. We haven't changed our message. You know, and no one ever wants to stand up and said, we told you so, we're right. But guess what? We told you so, we were right. You saying? So
You can take any statistic and skew it to be in favor of your bias.
Yep.
And that's what they were doing. They were taking statistics to skew it in their favor. We tried to show you, wait, hold on, that's not how you interpret it. And this is what we really should be looking at. And
Yep.
so, I mean, our perspective has never changed. And sorry they got found out. Sorry, not sorry.
Yep, exactly. So we're gonna now the sad part is that, well, I'll cover the last 10%. I'm still worried about what they're gonna do in the future. So, all right, we're gonna next, Jane.
So we have a question from Flash Online asking, do you have any advice on how do we get our 10-year-old granddaughter to take her supplements and herbs? Specifically, she complains about the taste.
Well, they are awful.
They're horrible.
I mean, she's not wrong.
I think the only thing that we've ever done with our kids too is that add some stevia drops. You know what I'm saying? And give them a little chaser after.
I mean,
take them.
I've pinned my kids down, I'll be honest. but I mean, they're used to it now. But I think one of the things that I used to do in the beginning was put it in like a syringe. And you can put a little bit of like water or juice or some stevia drops or something in there to like, but then you
Back
pin
and
them
throat.
down, put it in the back of their cheeks, and then have them swallow it that way. Chase it with some aloe vera juice or something like that. And eventually they get used to it.
Yep.
I don't know. My kids ask for herbs now.
Yep. Yeah, so do ours. They get so used to them that way. But also, we are very conscious of it. As we covered our quality last week and talked about that, I will never alter the herbs or reduce their concentrations or actually add anything in there that could make them taste better based on something synthetic or it would be bad for people. But remember, don't think we're not listening. We have worked now with my manufacturer to possibly produce a true gel that will be the same concentration and things like that. We've had some of them be a success. You're going to see those come out. And we had some not be a success. They just can't be in anything but a liquid form to be pure. So we got some pretty cool products come out that your kids will be able to take and won't taste like they're drinking dried urine. So it's all good. So yes. All right, what do we got next?
Now, we don't have much history here, but we have Cindy asking, as a 70-year-old, should I get a mammogram?
I'm going to leave that one up to you on that one.
I don't believe in mammograms at all. Okay, so as a medical provider, that tells you that you should do a mammogram every 2 years. Here's why. Now listen. Now I actually wrote my thesis on this in my master's program. That thermography is actually more specific. It has more specificity in figuring out a tumor prior to diagnosis than a mammogram does. It can pick up on it 2 to 3 years earlier. What it's doing is it's starting to pick up on heat patterns, and tumors require heat or blood supply in order to grow. And so getting a thermography, the first time is kind of your baseline, and then from year to year you can see how it may change. And if there's like a localized area within the breast where it looks like it's really red hot, then we have to, then the next step is to maybe do an ultrasound or something to see what might be going on in there. But listen, with a radioactive plate, taking your breast tissue and smushing it in between those two radioactive plates, it is exposing you to radiation. Radiation does not come without risk. Radiation is a cancer treatment, right? Because what they're doing is they're trying to wipe out those cells. So think about it. You have natural killer cells, immune cells, those things within the breast tissue to keep it healthy. Now when you're exposing it to radiation time after time, And a lot of times, how many of you women have had this? Maybe you can put it in the comments. That maybe you went in for your mammogram, they saw something abnormal, so they had you come back for another mammogram, and then like, oh, I think it's still abnormal. Maybe do it third, and then now we're going to do a biopsy. And we're going to poke and we're prod, and we're going to get rid of all your normal good cells that are supposed to keep your immune system strong within the breast tissue, and so therefore the cancer cells have more of an opportunity to grow and to fester. And so then they go in and do a biopsy that's going to take those cells and to further distribute them. Then they go in for a lumpectomy on any day of the month. And so for a woman that's cyclical, if you get your lumpectomy or mastectomy on days 19 through 21 when all your hormones are at your peak, that's a bad day. You need to be able to time that to do it on day 2 or 3 of your cycle when all your hormones are at their lowest, to make certain that those hormones aren't going to aggravate the spread of those abnormal cells. But these are the types of strategies that oncologists are not thinking about these days. And so they don't really care on if they're getting rid of some of those normal cells. In fact, that probably benefits their pocketbook when you do finally get a diagnosis. So I recommend thermography, number 1, getting that started as a baseline. And then if there's anything abnormal, they'll tell you the frequency in which you should follow up, whether it's every 6 months, once a year, every 2 years. And then if they do find something abnormal, I would push for an ultrasound or an MRI versus doing another mammography, because we just want to decrease the exposure to radiation across the board. Now, me recommending that, is that the medical guidelines? No. Could I get in trouble for saying that? Probably, but I don't really care, because I'm here to help you to be healthy. That's my role. So there we go.
Well, we always sat down and think about this. A couple things that we'll even pre on that. If you think about this, they say this, the average mammogram is about 1,000 x-rays per breast. If I took actually 1,000 x-rays on somebody, I'd lose my license. But then second of all, here it happens. I always say, okay, listen, that's the gatekeeping test. You're telling me we have it with all technology, actually had better imaging? We have. That's why it's non-diagnostic, and they move into more of an MRI and ultrasound. And I said, ladies, if you found something, just go right to an ultrasound. There's our technology to really dig deep on there. But on the flip side, let's even go here. If we look at some of the things that they do for, if you do have breast cancer, they're going to do some form of hormone therapy and some form of immune therapy. Well, why don't you get your immune panel and your hormones done when you're young and keep them good, so your chance of having breast cancer is very minimal. See, that's still the perspective. By the time they found a lump, by the time they find stuff, it's years and years of development. And I want to show you something. I have to tell our first story. Because she came in sick as it can be, being a labor and delivery nurse with PCOS. And I'm like, you'll be fine. And we reversed that whole process that way because of all the hormonal things that were going on. But here's what happens this. And as she learned that perspective, and think about her thought process now as a medical professional working in our perspective, when you look at the hormone changes, when you test a woman or what you do with them is different. I came along and said, you got to exercise, eat different on different parts of your zones of your hormones. And remember, when you get tests is important. When you do certain therapies is very important, because once again, your hormone levels can change those tissues. You go through 19 through 21. The breast tissue by nature are growing on a fast basis. That's why your breast tissue increases in size, because your estrogen levels and things are peaking and everything that way. So there's just a much different way of looking at it that way. But even if you step back, get an immune panel done on a regular basis, ladies. Get your hormones tested on a regular basis, because those are the predicting factors if you even develop in the first place, because they go to hormone therapy and the things that affect your immune system, they're negated. But
way more indicative versus genetic testing.
Exactly. Yes. Oh my goodness.
That's another soapbox.
Yeah, that's another soapbox in there.
But
so
anyways, just had to throw that in there.
But here's what happens. It's standard procedure for them to give you a therapy, a diagnostic that actually is used for therapy, but also is very detrimental to the breast. So, like I said, she can say this. I can say it because it doesn't really matter. I despise ultrasounds. That's
not ultrasounds.
I mean, I despise mammograms. I see no relevance to them. They're still doing archaic things for insurance and money. It's really sad.
Well, mammograms are so much more expensive than thermograms or ultrasound.
Oh, so much more.
And so people will say, well, they don't cover an ultrasound. Okay, it's $300.
Yep.
Okay, big deal. So do the ultrasound. It's not a big deal. MRIs and mammograms, those are thousands of dollars. And insurance is going to cover it, but is it worth it?
Right. I have a question here, because like I said on my email here, really good one. And I've dealt with this clinically a lot too. My daughter gets hives on her face, neck, and chest when she is in the sun. What could cause this? Do you want to start on this one, and I'll end on it?
Well, so first of all, just only in the sun. Okay, so think about it. What are hives? It's an immune reaction, right? So there's some underlying cause to that immune reaction, and so first of all, we have to find out the cause. That's step number one.
Because it's not the sun. And
It's
see, that's
not
the
the
thing.
sun.
But like she said, the key factor is hive is an immune issue. But if you think of it this way, the sun is actually a very good trigger for a nutrient for us called vitamin D. But just like excessive sun exposure can actually lead to detriment, even bad cells. It really can.
Yep.
But the key to it is this. When you look at the sun itself, it actually has protective layers before it even hits our skin. So you might have, but this child could have been on an antibiotic, which kills microflora, which leaves you more susceptible to the sun. Second of all, here's what also happens. This child does not eat enough healthy fats and has enough cholesterol. Because if you think about it this way, we were literally talking about this on our drive. People get food testing wrong because they really do. They'll say, well, doc, IgGs. No. Remember, we have a digestive system that's supposed to deal with every nutrient in our body. And if it doesn't, then our body says, ooh, you have something foreign in here, and now my immune system has to react to it, and there could be some inflammatory response. If it's skin, it'll look like a hive. So what this shows you is the protective barriers have been damaged, but also when the sun actually hits our skin and it can't actually produce and use its cholesterol to regenerate certain hormones, guess what happens? Your immune system says, I gotta deal with the sun now. See, so it shows that there's barriers broken down. It shows that your body's deficient in certain fatty acids, especially cholesterol, in order to actually protect and produce stuff in the skin. So there's a big deficiency problem. So probably some past antibiotic use, some microflora, the reduction in our skin, and then also, once again, some deficiencies that lead to us not using the sun when it actually gets into our cells. So when I had kids like this like crazy, good high-fat diet for a while, restore the bacteria, stuff like that, put apple cider vinegar on their skin, take a ton of probiotics, all that changes.
So fun fact, a lot of times people think that it's the sun exposure that gives you cancer, skin cancer. And actually there's been really great studies that have looked at this in mice. And what they did is one of my favorite ones is what they did is they looked at, okay, we are going to give one group of mice kind of the standard American diet, giving them high grains and high sugar and all these other things. And then we're going to give the other ones a whole food diet. And then we're going to expose them to the same amount of sunlight, and we're going to see if one group gets more than the other. And what's interesting is that the mice that from birth were given a whole food, super nutritious diet, none of them got skin cancer. And then about 70% of the mice that were given the standard American diet, exposed to the same amount of sunlight, got some form of skin cancer and actually sunburn. So when you get sunburn even can be a sign that there's some inflammation from the inside. So people that get sunburnt versus people that don't, yes, there can be some differences in your skin structure for sure, but a lot of it has to do with your diet. So interesting. So people think that you have to avoid the sunlight to avoid skin cancer and put a bunch of toxic chemicals on your skin and sunscreen to avoid it. Again, you're drinking the Kool-Aid. That's not how it works. You got to work on your internal environment first.
But don't drink Kool-Aid because you have too much sugar.
No, drink the kombucha.
All right. Dr. Jenny, what do we got next?
So when Nicole was talking about how mammograms have so much radiation, we did get a question from Debbie asking our opinion on echocardiograms and if they are safe.
So echocardiograms are more of an ultrasound, and that's not going to be as detrimental. Now, I'm all for imaging. I think if you, no matter the image, is there going to be some toxicity in a PET scan and an SDT with contrast? Yeah, there will be. Your body will clear it. It'll be okay. But the more imaging that you have, the more information that you have about what's going on within your body. Echocardiograms looking at how the heart pumps blood, how effective it is at pumping the blood. It's important. So pros definitely outweigh the cons in some of these things.
Well, we take X-rays.
We take X-rays. I mean, there's yes, I'm all for any kind of imaging to give us all the information of what's going on in the body. But the mammograms is just something I'm a little bit more hesitant on, because it's not like we're trying to find something, and we are trying to find something, but it's a form of prevention. Like, imaging shouldn't be a form of prevention. Imaging should be a form of investigation. Okay, so there's a difference there, and so that's where I'm okay with echoes. I think that if you have a heart issue, you have to have an echo, and that's just fine.
And on top of it, for example, let's go back to this. If we take an X-ray of you to look at your GI, to look at your spine, look at your neck, guess what happens? There's a certain amount of radiation. Take some vitamin C. You do a mammogram, you can't take enough vitamin C to actually create the oxidative stress that comes from it that way. It's just too severe. You say, and there's other imaging, and that's one thing. And I always tell people this: there's always advancements in technology. So when you hold on to the old gold standard, I say, listen, platinum's better. Let me give you an example. When I started practice, when you want to look at blood work for inflammation, does anybody want to take a guess what the marker was? It wasn't it wasn't CRP because CRP didn't exist when I started practice. It was ESR. ESR. It's the sedimentation rate. And I could look at a general idea of inflammation. But then what happens? Technology came out. There was a better form of actually looking at systemic inflammation called CRP. So we started doing that work. Okay? The same thing. We've advanced, even the medical field has advanced in their technology that they're still using the ultrasounds, or still using mammograms. You understand? It's like there's great technology that can go beyond that. But once again, it's top dollars, man. They've already got women convinced on them that way. There's so much money in mammograms. It's absolutely crazy.
What I would recommend, like if I could change the guidelines, what I would say is that we would do a thermography, like every 2 years, just to kind of check. But then I would require you once a year to get a Dutch test. And some other things to look at your hormones and your immune panel. And then what I would do after that is if we found anything starting to trend abnormal on a thermography, then I would go right to an MRI or like an ultrasound. If it's ultrasound won't pick up if it's super tiny, but if it's a little bit bigger, but if it's super tiny, you can look at the characteristics within an MRI and really have a pretty good understanding whether or not this is benign or cancerous. And so that's what I would do. But I guess I'm not in charge. Maybe someday. Maybe I should apply for Fauci's position.
Oh, that's right. He's retiring.
Yeah,
he's retiring. He's trying to give himself a big retirement package too, and some of that. We have a retirement package, just not the one he wants. So, anyways, I said there's a great cell. He can get 3 meals a day in that cell. So, what do you got, Jane?
Can the Wellness Way help reverse factor 5?
Can the Wellness Way hurt factor 5?
Help reverse factor 5. So, no.
I was gonna say. Yeah, I can't look at it that way, but yeah, go on.
No, so factor V Leiden is a genetic mutation that affects the way that your body, it puts you at risk for blood clots, right?
Big time.
So with factor V Leiden, what you got to be, so we all have a genetic blueprint, right? And so some of these things can be passed down, but then also your genes, whoever can figure out how to turn on or off certain genes is going to win, like the Nobel Peace Prize for every year to go on. Now there are certain things that can trigger genetic expression, and that's where the kind of the perfect combination of that genetic expression can put you more at risk for cancer and other things. But that doesn't mean that your genetics gave you cancer. It puts you more at risk, and if you have a sick environment and you can't handle it genetically, that's where it can start to get bigger. But with factor V Leiden, there's nothing you can do we don't know how to turn off specific genes. Now, with that being said, can we create a really healthy environment that could potentially prevent genetic expression of factor V Leiden? Sure. You can't really test for that though. You can't really see, is it on, is it off, is it being expressed, is it not? But there are certain things that you can do for life that could help you to make sure that your blood is thinner to prevent a blood clot in the future. So that could be like things like fish oils and
cod
turmeric,
liver
cod liver oil, is one of the best things you can do to thin your blood. And people like that have MTHFR or COMT mutation, you're not a victim of those genes. Just give yourself some extra B vitamins. Figuring some of this stuff out are things that you can learn how to supplement your body and support your body to operate at its best. But actually turning that off and reversing it, I don't know that anyone on the planet knows how to do that.
No, but you can do this, and you can even confirm with your docs once you do it. It's cod liver oil, turmeric, Neo 40, and then actually you can measure your sedimentation rate and things like that. You can have your doctors measure on a regular basis. You'll be able to maintain. But remember, just like we talked about before, everything still comes back to find that chronic inflammation. Because yes, turmeric, Neo 40, cod liver oil has a great job, and actually they've done studies just on cod liver oil, thinning the blood better than Orphan. And that's what it is. It's really good to actually do those things.
4,000 units.
4,000 units,
That's what the study said.
Yep, study says 4,000 units. So, and remember that thing, just jump on PubMed, you can see that. But here's what happens we would more say, but if you reduce chronic inflammation, your blood gets thinner by nature.
Yeah.
See, people don't realize your blood is thick because you're so chronically inflamed. Yes, you can take things that can thin it out. I just gave you 3 major things. But just taking 4,000 units of cod liver oil is good, and you're going to have a better result, but you're still going to trigger the gene, you're still going to trigger more genes, you're going to do all those things. So step back and go to the different perspective of actually reducing your systemic inflammation. Then you can actually take those things, have a really positive effect, and you can manage that without taking some form of medication for a long time.
Well, I mean, and for the viewers that don't know, when he was talking about checking inflammation with a SED rate, ESR value, What that is it's seeing how long it takes for a red blood cell to drop to the bottom of a test tube.
Yep.
So the longer that it takes to drop, the thicker, the stickier the blood is, and the thicker, the stickier the blood is, you have more of a medium for cancer cells, for sugars, for abnormal cells to move about the building. And so that's why with a higher inflammation, you're at more risk for chronic disease.
Yep.
And so that's where, when we're trying to figure out how do we thin that, well, making sure you have proper blood sugars,
Yep.
making sure that you're properly hydrated, you have good electrolyte imbalances, making sure you're taking the cod liver, all the fats and all those sorts of things.
Yes.
Supporting a healthy liver, and then that's what is going to help that SAD rate to come down.
Yep. So that's the best way to deal with it. What's next there, Jane?
So Cindy's asking, do you recommend probiotic after being on doxycycline for Lyme disease? If so, what would be good for an 8-year-old?
She just answered her question. Yes, it's very good. Once again, and remember, but always do this. The interns will be at my house, tomorrow night, and I still make them all, when they're at my house, take actually at least a tablespoon of sauerkraut. You know what I'm saying? You come to the Flynn household, you're getting sauerkraut, you're getting liver. You know what I'm saying? It's kind of great because what that does, you need to have your fermented foods on a regular basis. Do we supplement with a very specific probiotic? Yeah, I actually worked with an amazing PhD immunologist to actually even produce ours. But the idea is this: it's good to compensate that if you've taken some form of medication because you need a higher dose than just your foods. But doing fermented foods on a regular basis is still the best way to restore all your normal flora. Can you take a couple bottles of different probiotics? Absolutely. I encourage that dramatically, especially if you've taken some form of antibiotic or antifungal, because you need to restore it that way. So, so just get them to take it in short time, but then go back to your foods. All right, what we got next, Jane?
All right, next we have, why are depression medications so prescribed with no analysis besides how people feel?
Why don't you take that one?
Okay, so why are depression medications scheduled with no analysis? Well, that's because, first of all, mental health, up until now, people have thought, the medical thinking is that you can't quantify mental health.
Right.
Is that, you have to go based on what people feel and seeing, are you feeling anxious, are you feeling depressed? There are screening tools that we use. One is called the PHQ-9 score and a GAD-7 score. That is a list of different questions, 9 and 7 questions respectively, to see if you have depression or anxiety based on a questionnaire. So that's the main thing that they use to decide what sort of dosing that you're going to start with, is by filling out this questionnaire on how you're feeling. And that's how it should be done anyways. Prior to prescribing antidepressant, is you should have to fill out the GAD-7 or PHQ-9 to be able to come up with where is your, what level, are you mild, moderate, or severe anxiety or depression. And then once you have that documented, then you have full authority to be able to prescribe one of those medications. But that's the fireman perspective, is if you have a problem, let's fix it with the drug, right? So we only have 2 tools in our tool belt, drugs, and we have surgery, and there's not a surgery that can cut out your anxiety. And so therefore, they have to go straight to the medications, because otherwise they don't know what else to help you. What are they supposed to do? Tell you to meditate? I mean, like, you're there for some sort of reason, and so they're there to help to meet that need. Well, when they come to the Wellness Way, we have some specialty testing that I don't understand why isn't mainstream, but we can actually test your neurotransmitters. We can test your serotonin and your dopamine and your norepinephrine and your histamine and all the things that make you feel happy, sad, anxious, depressed. And when you can see certain patterns, you can see where maybe the body may be deficient in, magnesium or something that helps with some of those conversions, and to be able to help to balance that out. But herbally, what we use for a strategy to be able to help to calm a really anxious response or lift more of a depressed response is very different strategies, and that's where we like to have some of that data to try that, to be able to make good recommendations for you. And that's why some people can say, I took St. John's wort and it didn't work for me. Well, maybe that's not what you needed.
Wrong strategy.
Maybe you needed some Mucuna seed, maybe you needed something else. And so being able to test that can help us to help you to figure that out. But more than that, 80% of your neurotransmitters are created within your gut. And so therefore, most of the time when someone comes to me with depression or anxiety, I'm ordering a stool sample. And the people are like, wait, what? I didn't tell you there was anything wrong with my gut. Well, no, but I know physiologically that if those neurotransmitters are coming from the gut, then that's what we have to look into. You guys, the simplest example that I give is that of stage fright. If you're feeling anxious before going on stage, where do you feel it? in your gut.
And you get diarrhea.
You don't feel it in your brain, right? Or if you're getting really excited to go on a roller coaster, I'm a huge roller coaster fan.
Yes.
You feel it like, ooh, in your gut, right? And so those are some of those things that are just that example alone can show you that it's important to make sure that you're getting good gut health and figuring out what's going on.
I just have to stand here. I feel like a proud papa. Listen to her talk. When it was the second day she knew me, she sat down and said, teach me about vaccines. In about 15 minutes, she's like, I can't believe this, you know, Sam, and it changed her world. And see, so if you're a medical professional watching right now, you wonder why Nicole is a big part of our academy, a big part of our teaching part, a big part of this way. Because you know what happens? She had to think of it this way. If I would have told her when she walked in that I'm going to do a stool test for some, and she didn't have emotional problems. She had PCOS in that way. If I would have said, and she was a nurse at the labor and delivery nurse. She finished her NP when she was with us that way. But I want you to think of this. If I would have sat down with her as a medical person and said, as a nurse, said, listen, you have some emotional things going on. I'm going to run a stool test. She would have looked at me like I was crazy. But look at her words now. Because she understands from such a different perspective, which is just, I hate to say this, basic biochemistry, basic immunology, basic anatomy. And that's why when you sit there and go, why can't the medical field get it? Because when you look at the management, they don't have our tools. When I showed her how to use a neurotransmitter test, it was like, the data's right there. It's a CLIA certified lab. It's what all labs are, even medical labs are certified by. It's not like these labs are anything that we specially created, but you have to have that perspective. And that's a big thing. So proud of you.
Oh, thanks, Papa.
Yeah, Sam. So, the next one.
So we have a bunch of questions, people waiting on answers here. I am going to jump ahead because this one that just came in is making me laugh a little bit.
Okay.
It says, my husband shaves his head, but his shaving cream has a bunch of bad ingredients.
Aww.
What does Dr. Patrick use?
Oh.
Kiss My Face. Do you understand? I mean, not really Kiss My Face. I mean, Kiss My Face is the brand. You understand? It's a great brand. I actually shaved this morning. I grow facial hair and everything like fast. You understand? So I got to shave like minimally every other day and everything. That's why if you see the kind of video, the intro video they have me when I'm like didn't shave for a day and like during hunting I don't shave for a week and it was like crazy. Yeah, but just I use a very good organic thing that way. That's and I will tell you there's a dramatic difference between like Gillette, all the chemicals, and actually a natural blend. Okay, so yeah, so I use just a really nice. I think it's Kiss My Face.
Look at this nice little cue ball he's got going on here.
It's like,
yeah, it's nice and
smart. You understand? Put it all over my head, put it on my face. Hey, remember, this is Manscaped on a regular basis, you understand? So it's like...
I don't shave my head.
Yes, yeah, it's great. But yes, just there's great organic one. Sit with a razor, and Dr. Jacqueline's husband, Paul Burns, is kind of funny. They have this like really cool, like electric razor. So I do that, I don't like to shower every day. I don't like to shower every day because you lose some of your, no joke, hormones, and also lose some of your vitamin D, lose some other bacteria by showering every day. So I do it usually every other day. So that's why I kind of shave only every other day that way. But I take that razor every day. Otherwise it grows
every
too
day?
fast. Every day. So, all right. Good question. Love that question.
Nice. So there's a lot of talk about high blood pressure.
Yep.
What is your thoughts on low blood pressure?
That's pretty easy.
Just as detrimental as high blood pressure.
Yes. Just like high blood sugar, just as bad as low blood sugar. Whenever you look at this, and here's what I want to show you. There's a simple test that everybody can do at home. It's called the Reglan's test. If you Google search right now, just take your blood pressure when you're laying down. See, the 120 over 80 was based on resting for 20 minutes and then taking it. When was the last time you went to a doctor's office, they laid you down for 20 minutes and then took your blood pressure? That's what the whole 120 area is based on, okay? It's called resting blood pressure, and you have to be laying down for it. Now, Reglan's test proves to you by sitting up, they're misleading everybody because all you have to do with Reglan's test is actually elevate or even stand up, and the millimeters of mercury are supposed to go up about 20 points. So instead of being 120 over 80, it's supposed to be 140 over maybe 90. And what happens is this, and if your adrenals, if you're lacking catecholamines for vasoconstriction, which are, once again, hormones in our body, they create the vasoconstriction, your blood pressure will even stay the same or drop a little bit, and that's why there's some problems. So when you really do look at low blood pressure, can there be some vessel damage? Absolutely. But the majority of it actually are missing certain hormones that are from the adrenals, and that's why low blood pressure happens. Plus, I know it sounds funny, most people don't eat enough salt. So you can get high and low blood pressure from actually not having enough salt. Mm-hmm. Yep.
So this next one, always a hot topic. What is your stance on marijuana?
You want to start or you want me to go first? I'll go first.
mean, I like it.
Since I own the company, I'll say it first. The Wellness Way, we support marijuana like crazy.
Yes.
Heck, I had a gummy the other night. You know what I'm saying? It's like, yeah, and let's even go from the medical realm. Let's start here. Nicole, what is the manipulated anti-nausea drug that they give cancer persons so they don't throw up? What is it? What is it derived from?
Well, ondansetron, Zofran
Yeah.
is what they give most people.
Which is a derivative of?
I don't know.
Marijuana. It's a marijuana drug. Come on now. She is a cancer doctor. But no, they actually use it. They actually use a synthetic
What
form.
kind of shit they put in there?
Yes. Well, they actually use marijuana. It's anti-nausea. No, they're wrong. Marijuana actually has some properties with the cannabinoids and other immune factors that they've been known to actually even affect cancers. Okay. So if you think of it this way, what's marijuana anyways? Just an herb.
Well,
It really
so you have a system in your body that was
Yep.
actually designed specifically for marijuana.
Yep.
I mean, it's an endocannabinoid system. Your
Yep.
body actually makes cannabinoids itself. It just makes a very small amount of it.
Yep.
But the only thing that can unlock that system is cannabinoids.
Cannabinoids. Mhm.
And so that system is responsible for regulating both your nervous system and your immune system. And so that's why in some of the really high quantities, it's really fabulous for cancer.
Yep.
Because it can help with some of the nerve damage and the pain, and then also help modulate the immune response. Now, what happens is when people recreationally have done it with primarily THC
Yeah.
and not the CBD, that doesn't really serve you much medical benefit
No.
because that's going to just give you hallucinations and things like that. But it's very important to have a good ratio between
Yep.
the THC and the CBD, and the CBD is that cannabinoid part that's going to get this into the cells. That's going to be really helpful.
And that's why it's better to eat it than smoke it. But I would say this, okay? I would tell this. I would rather see a person smoke marijuana than take an antidepressant drug.
Sure.
I would, by far. I mean, I'd weigh out the ratios going, I'd rather see that. And it's why, and with stress being so high in everybody's life today, I see why people abuse marijuana. I don't mean to never abuse anything. Remember, you can abuse any ingredient from a food too. You know what I'm saying? You can, if you eat Happy Bellies every day, which is one of my favorite bakeries, you're gonna get fat. You know what I'm saying? You are. You're abusing. I love their stuff actually, or Naturally Delightful, which my daughter. Did you bring me my dessert, honey? Okay, my daughter brought my dessert from Naturally Delightful, amazing bakery here in Green Bay. But if I eat that every day, you know, I'm going to be 300 pounds. Okay, you don't want to eat that stuff every day. But I do this. So same thing with marijuana. But my stance is I've seen such great clinical benefit from it that way. Like I said, every once in a while I'll take a gummy because believe it or not, I know it sounds weird. Owning a big international company, every once in a while I do have some stress. Every once in a while.
He is human.
Yeah, every once in a while I will do that way. So my stance is, you know, go for it. Be smart with it. You know what I'm saying? Be smart with anything. You know, I've had to have Nicole sometimes every once in a while give me something to take just because something to go through. You should be smart with it. I believe that that medications that have side effects can be used properly from the right individuals and right perspective. Same thing about marijuana, same thing about herbs, same thing about synthetic drugs. They all have a purpose. And I just love that our company recognizes that because we get frustrated. We'll sit there and talk about this. We get frustrated when you have the over natural people that are just like, all medications are bad. I'm like, really? Have a cavity and get drilled your tooth without Novocaine. Drug me up, man. You know what I'm saying? And there's people that I do without Novocaine. You're more of a man or woman than I will ever be because I couldn't handle it. On the flip side, just like you've seen the last 2 years, you know, everything's so medical that people, you know, they think that if they go to people like us, they're crazy. I think you're both wrong. I think you're both have such a wrong perspective on life in general that you're crazy. You know what I'm saying? And that's why when I wanted to create an analogy, go fire department carpenter, it recognizes the strength in both. We just have, and that's why, remember, my major doctorate is a chiropractor. And yet medical people from all over the world want to do this perspective because the perspective is based on, once again, the principles of how the body works. And we just stand on, we know it works this way and we're gonna test it differently. That's why we can do a neurotransmitter test that medical field could do too. They can do it. It's not like we own the test and specialize it. It's actually a medical lab. It's just that we have the perspective to be able to know what to do with it once there. So, yep. So go have a gummy. Have a nice day. So what's next?
I loved your last show on quality, and it shows your commitment to giving us the best. What is one herb you would pick for a woman that wants to start her health journey with you?
I would say Sisandra. It's actually known as the longevity herb for females because it has probably the most positive effect on the liver, which is hormone conversion, skin, everything that way. I think that's why I think for women, if I could pick one, just one. Now, obviously I have a bunch more, but Schisandra would be the dominant herb, I would say, for women. Men, I would say milk thistle, okay, would be milk thistle, just because women need a lot more hormone conversion. Men just beat their GI up like crazy and become fatty liver really quickly. They drink too much alcohol. Men consume a lot more sugar than women. People don't realize that, but they do. So therefore they get fatty liver, which relates to a lot of diseases, including hormone problems, everything that way, heart disease like crazy. So I would like to see milk thistle for men. Women, I like to see Schisandra. You can have a different perspective. What would you think?
No, I mean, those are some good suggestions. I think that the thing that kills women the most is mental stress. And
Yes.
so this number 2 would probably be California poppy.
By far.
So California poppy can really help you with that kind of stress response and kind of just calming you down, because a lot of times if you have hormonal issues or something, it can become from that anxiety aspect, and that's really helpful as just kind of a chill pill.
Awesome. Now we're gonna bring. I didn't know she was coming today. One of my right-hand people, Amanda, come on up here. Amanda, come up here. She is. She was just down with Nicole. She's one of our big student programs, and because we know there's a lot of students watching, so Amanda's here. Come on her. See, that's all right. Saying hi to her. Her and Nicole and Beth did a wonderful job at the student program. So good morning. Nice to see you. So all right, go see.
She's like, and I'm out.
Yeah, no, if you were part of the student program, you know that woman and stuff like that. So she's an amazing woman that does great things for the Wellness Way every day. There's so many behind the scenes people. You know what I'm saying? It's like, we have a studio full of people right now and everything like that, but that's one thing. We get a lot of attention because we clinically out there, we're doing things on a regular basis that way, but there's hundreds and hundreds of people behind the scenes that you never see that are just top notch, and Amanda including one of them that way. Travis over here, everybody. I can go on a list of just absolutely incredible people, and it's nice having such great people. So yeah, it's kind of fun for us. Like that. So all right, what we got next?
I think with all the talk we do with women and mental stress, someone asked, does mental stress also affect men?
Yes, it does. But see, let's this. And if you've been to my hormone seminar, and like Nicole said too, mental stress destroys a woman faster than anything. It really does. Men, when it comes to hormones, though, are not affected the same way. Because what happens is this: if let's say Tristan comes and attacks us right now, and he's a big, muscular, strong guy, and his wonderful girlfriend's here. Thank you so much for joining us and stuff like that. What happens if he comes attacks us? My testosterone's going to go up. My hormones are going to be jacked up to try to fight him off. Hers are going to tank. So from that mental stress, mine will go up, hers will be hurt. But here's where we're both affected the same, and I think this is where men are so affected by mental stress that it just messes up their health. Is there's an old saying, don't swim after you eat. Well, because here's what happens. When your body's in rest and digest, parasympathetic dominance, guess what happens? It's cool. Everything digests that way. But the minute that we go into fight or flight, our stomach reduces its acid production. Our GI slows down, so you don't want to go into an athletic event after you ate because the food could actually cause some problems in there. So the digestive process in both men and women slows down dramatically. So when men have mental stress, it really destroys their gastrointestinal system, reduces their stomach acid, which if you want to look up the term, it's called hypochlorhydria, which is low stomach acid, which can result in so many healthcare problems. It's crazy, especially for men. But it affects women the most that way too. So I would actually say men got to be very careful with mental stress when it comes to their digestion. If a man's going through a lot of stress, this is good for them. They should fast. Women don't have that luxury. It can really hurt them. But so if you're stressed out, do me a favor, don't eat. Don't eat. You know what I'm saying? You need to fast. So, yeah. Okay, what's our next?
I take betaine and it seems to help, but I don't get any burning. Can I take more?
Yep.
There you go. You want to explain the physiology behind that though first to him, then we'll, yeah.
Okay, so with stomach acid, you need stomach acid to be able to do a lot of processes. And most people think that it's there to primarily break down protein, which is a main function of the stomach acid. But the number one function of the stomach acid is actually to sterilize everything that you eat, because everything that you take a bite out of has bacteria, yeast, maybe some parasites on it.
Even viruses.
And so viruses. So when it goes down into the stomach, it has a pH of 2. If I were to take it and throw it onto this table, it would burn straight through. It's extremely, extremely acidic. And so what happens is it can wipe away all of those, things you can only see on a molecular level, right? And so what happens is if you don't have stomach acid and then something comes down and you have a very small amount, well, the stomach is a muscle and it has to get that through to the small intestine. So it's going to start to contract and that acid's going to whoosh around. And it's going to get into the esophagus that can't handle the pH, and that's what gives you reflux.
Yep.
Okay. Well, if you have a stomach full of acid, when that food comes down, it doesn't have to contract. It doesn't have to whoosh around. It just instantly sterilizes. It breaks it down and it continues to go on down. And so what happens is when you take betaine, that's going to help your body to make a little additional amount of acid. And so if you're not feeling a burn, so usually how I tell people to dose it is you take one at a time and you wait like 10 to 30 seconds. And then you see, okay, am I getting a little bit of a burn? Yes or no? And then after you get to like, say, I don't know, say 10 pills, and you finally feel a little bit of a burn, that means, okay, now we're filling that up to the top. So that's probably one too many. So take one less. So if you get it at 10 pill, you're going to take 9. Now I've had patients call me and they're like, Nicole, I'm on like 20, 30 pills and I still don't feel a burn. Dang, girl, you need this. So like, yes, you can take more, or you can just pick something reasonable and not take 50 pills before every meal. But you can, everything that you're going to be taking can be beneficial. But mental stress can drain your stomach acid. So women sometimes struggle with that. Physical exercise can actually drain your stomach acid. So if you're an avid exerciser or worker outer or whatever athlete, that's something. If you do that a lot, the thing. That's something that you're gonna maybe need a little bit extra. And so, but hoping to kind of help to restore that so that your body can take over that production, as long as you don't keep draining it, is gonna be important.
When I first started practice, I did a little differently until I realized you could actually mega dose to see where they burn. I used to have people, they still have these, you can buy them online. You can actually take a pill that has a strip on it, you swallow it and it goes down, and then the strip sits, it's a pH strip that sits in your stomach, and then you pull it out. And it'll tell you how much pH is in your stomach that way. Most people couldn't do that because of the weird feeling and stuff like that, but you could diagnostically do it that way. And then I just started loading them, going 1 pill, 2 pills. The highest I ever got was, I think, like 21 pills on somebody. And they took that before each meal for a while and stuff. And you're going to find out, like I said, and that was a good question come before, mental stress just really shuts down the digestive system. And so if you don't have enough stomach acid, you set yourself up for a lot of infections in GI, a lot of overgrowth, a lot of yeast overgrowth and stuff. And the reason why you see candida is such a big problem today is because we lack stomach acid. Candida is a normal flora. That's why I like people to say the anti-candida diet. Makes no sense because you need candida to digest food. But if it overgrows, you can have a yeast infection. See, so the concept of anti-candida diet is just makes no sense. I want to kill off my candida. Well, then you have bad digestion. So next, what we got?
What are your thoughts on a calcium score for the heart?
Ooh, I'll take that one because I'm doing one here in a couple weeks.
Love it.
Yeah, exactly. I really love it. Love it. And you talk about the imaging. Once again, you're getting a CT done a thing, and you can see the calcium score, which means, for example, is when there is damage, inflammation, calcium can start build up, and yes, there is a cholesterol component to it that way. But the calcium score is even a better predictor of future heart problems than cholesterol panel itself. And we were going to do some cholesterol and some true markers for heart disease because the overall total cholesterol is not a good judgment of heart disease at all. And stuff, and I know a lot of people say, yes, it is because of this. No, you're taking out of context and stuff of that. There's better markers by all the people that you can actually look at when you don't understand cholesterols that you can move into that way. But I love calcium scores. I did it. I used to do it every couple of years. Mine's still at 0. We had this with a wonderful, long time, my first ever patient, still patient today. His name is Ken. They wanted to put him on a statin drug. I'm like, well, go get a calcium score done. You do it right at the same hospital. They want to do it that way. Calcium score came back. I think it was only like 20 and stuff of that. And they're like, and then because they said, listen, with your cholesterol levels, you're going to have heart disease that way. And they did calcium score, and doctor says, well, it looks like you're not going to have heart disease, so we have to just kind of change your diet. It was kind of funny. But the diagnostic, but there you go. The diagnostic, which calcium score test, did not exist when I started practice. See, technology does evolve. You understand? So it's good to actually, so I love medical advancements when they're looking at imaging, not treatments. You understand? For example, like I said, we've seen, which is going to in the last 10%, the COVID vaccine, once again, as their treatment, was a disaster. And now they're trying to backpedal a little bit. So I love them. Next one.
All right, this one's from Marquetta saying, how can I support my cannabinoid system with a hemp seed allergy?
Marijuana. You understand? Marijuana. See, people have such a mental thing about it. People will take toxic chemical chemotherapy and they'll worry about a drug or worry about marijuana.
Or even Tylenol.
Tylenol, which is more poisonous. It's like, it's really funny because people say, doc, can you overdose from eating marijuana? No, you'll fall asleep. You will. You can't overdose from it that way. You understand? It's like, could you eat too much and your stomach does like and puke it up? Sure you can. But that's, you could eat, here, watch this. If I give the average person a bowl of broccoli, unless you're allergic to it, majority of people are going to get a really good nutrients from it. But guess what happens if I give you 10 bowls of broccoli? You're puking it up. It's too much. Your body will reject it that way. So the idea is this, and the nice thing about marijuana, you just sleep for a long time. I remember the first time I did marijuana oil, I slept for 18 hours. My wife thought I was dead. You know what I'm saying? I was like,
I slept a long time too.
yeah, I was like going 18 hours. It was kind of crazy. I was like going, oh my goodness. Because I took some oil and everybody felt high and I didn't. And for some reason, my liver processes marijuana so well, I don't get high from it that way. All of a sudden, next thing you know, I'm taking more because I'm like, all you guys are smiling and giggling and want some chips and I'm sitting there as normal as can be. And so I'm like, took some more.
Until it hits you.
And then I was sitting watching TV and I'm like, those are some really nice colors. I'm like, holy crap, I'm going to bed. 18 hours later, I woke up. So, not a joke, true story. I'll share transparency that way. And some of that just happens. So, yeah. So all you guys that take a little oil and get, feel it, I don't.
He's the guy that gave me my first oil.
It was awesome. Yes.
Like, it's not every day your boss can make you.
All right. Here, watch this. There you go.
Yeah.
So, well, true. You know what I'm saying? Well, and that's why politically I'm big on freedom. You know what I'm saying? Wisconsin Republicans, pull your head out of your ass. Marijuana should not be illegal in Wisconsin and stuff like that. It's funny. It's like, laws got to change. Anyways, no politician, Democrat or Republican, should actually negate you making your choices anyways and stuff like that. But but the Wisconsin Republicans, which once again, I'm more on conservative realm that way, but I'm going to fight them every day and try to get marijuana legal for everybody and things. So here's your own choice. So anyways, nice one.
Next.
All right, so Carla's asking if someone has had their appendix removed, is there something they should be taking or doing to compensate for the job the appendix did?
Yes. Do you want to answer that one? Do you want me to?
Sure, go ahead.
Okay. The one thing that you have to understand, and remember, when I was in school, they taught you the appendix was a useless organ. They actually kept people convinced it's what's the only known useless organ in the body. Now, if it's so useless, why is it that you can actually explode, rupture, and there can be toxic effects from it? Because it can kill you. You know what I'm saying? So here's what happens. It's an immune organ. Now they realize it's an immune organ. What the immune system does, it removes foreign things that don't belong there, all right? So if you think of it this way, think about where it is. It's actually extracting everything from chemicals, the bacteria and stuff out of your system, trying to break it down and actually neutralize it that way. That's why it's an immune organ. Now here's what happens. You just got to take care of your GI. You got to stop toxifying yourself. So if you've had your appendix removed, you have to have a better diet. You have to keep a better GI. You have less chance of having a yeast overgrowth because your appendix is one of the organs that can help you with it that way. So you need to be better than everybody else. It's like if you have a gallbladder, you need to gallbladder removal. You need to actually have and be better at what you're eating, so get better fat absorption than if you didn't have it that way. It's an organ of your immune system that you have to protect yourself against. So you have to be better in diet, have to be less toxic, have to take care of your GI better because you're missing one of the main organs that actually help it clean out.
MS seems like a very common diagnosis. What is causing the rise in it, considering the amount of diagnoses has tripled in the last 15 years?
I'll let you take that one. I have some opinions, but I'll let you take that one.
Yeah, so, well, MS isn't the only thing that's tripled in the last 15 years, let's be honest. I mean, in the last 15 years, with more and more medical advancements, we are not getting healthier. We are getting sicker and sicker, and that's just because of the culture that we live in, the food that we eat, the ways that we are trying to cover up symptoms with the medication versus finding cause. It's just the whole thought process is we're never going to get healthy the more organs that we remove and the more medicine that you go on. There's not a medicine that can restore your health, bottom line. Now, I have several MS patients that have had absolute incredible results. I have one woman right now that's seeing both me and Dr. Steven for some corrective chiropractic care. And she literally couldn't walk without assistance when I first met her, and just went on a 3-mile walk the other day.
Nice.
And she is just like, her life has completely changed by working on inflammatory responses, working on her gut health, doing some detoxing. Infrared saunas have been amazing for her, because when you're thinking about MS, it's both an immune and a nervous system issue. And so the two, if you your nervous system or your immune system is the sickest, those are the sickest people ever. Those are the two systems we got to care for the most, which is why one of the reasons why we love chiropractic, because that's one way that you can care for your nervous system, right? And then the immune system is making certain that we are aware of all of those different triggers. And so have we gotten better at caring for the immune system over the last 15 years?
Worse.
No. Has there been more vaccines introduced into the industry in the last 15 years?
Yep.
Has there been more treatments for whatever maybe in the last 15 years? Sure. Has it become mandated by your employer to get flu vaccines and COVID-19 vaccines and all these other things over the last 15 years? You know, there's not only are these medical advancements here now, but now they're being forced onto people whether or not you want it at all. And there's so many people that aren't asking enough questions as to whether or not that could affect their body. And so I think that over time, it's only going to get worse. We predicted this in 2020 that we're going to see the highest rise of autoimmune disease and cancers that we've ever seen before because of this is just the way we do things now. And actually, Joe Biden in his State of the Union address said that he's calling on Congress to fund $6.5 billion into a project called ARPA-H, Advanced Research Projects, I'm forgetting it, of health, something. Basically, what they want to do is they want to try to create a vaccine to prevent almost every chronic illness. They want to create an mRNA-based vaccine for hypertension, an mRNA-based vaccine for Alzheimer's, an mRNA-based vaccine for cancers to address 50 genetic mutations that cause cancer. Do you really think there's only 50 genetic mutations? Let's be real. And so, and they're calling this because they want mRNA technology to be the basis for medicine moving forward. So do you think that MS is going to be going maybe quadrupling and plus 100 times over in the next 15 years? You better believe it. And so we have to start asking a different perspective of, okay, my body doesn't need more vaccines to become healthy. My body needs to I need to start pulling triggers from the body, detoxing things out so that my body can operate at its best.
And you think about it this way is this. I will say this, I'll be very clear. Vaccines are the most detrimental thing in human health. That's why I will fight against them every day the rest of my life. Don't believe the polio BS. Don't believe all the vaccine BS. That's what it is, okay? And that's why I was very saddened for COVID, but actually it showed people how bad vaccines really are.
It woke people up.
Because here's what happens. Autoimmune diseases are all-time high. Yeah, you know why? Because you're triggering kids since they're little. It's why kids' diseases are all-time high. Even though we have more vaccines ever in history, more treatments ever in history, you're disrupting the immune system earlier than ever that way at such a high rate. And I'm proud. My 4 daughters were never vaccinated, never will be, and stuff. And hopefully keep that tradition going for family generations that way so we can raise healthy kids. But if you think of it this way, MS itself is an autoimmune condition. You trigger the immune response and now starts destroying the brain. You trigger the immune system, starts destroying the GI. It's a different condition. It's joints, rheumatoid. You can have celiac, you have Crohn's. You know, all these autoimmune issues. And so I always have a simple question because here's the perspective. And I ask every medical person this. Does a vaccine make the immune system normal? No. Actually, if you think of it this way, they even convince people with their current vaccines that actually alters the immune system, creates inflammation, creates damage, but that's okay, it's normal. No, if you have their perspective. See, that's why I would love to debate Fauci or any medical. I actually asked I sent requests over to, they let him on TV every day at live segments of the guy that runs Purveyor or whatever his name is. He should be criminalized too. And he's on there, you know, he was actually on talking about the COVID vaccine, how great it is and all the stuff that everything now the CDC is saying the totally opposite now. Hey guys, why isn't he arrested? Giving bad advice that damaged a lot of people that way. You understand? Or why isn't his medical license employee, why isn't he fired? See, the thing is this, it's like vaccines are most detrimental to human health. I ask any immunologist, I ask any doctor from any local hospitals, I will pay for it. Let's do a debate. I will rent out the Widener Center. Give me a chance. As I said, why don't we go in the vaccine debate and trust me. I'm going to ask you one question, which is going to shut you up. Does a vaccine make your immune system normal? No. By nature, they skew the immune system, and by nature, that leads to every disease on the planet. See, so you got to ask the right questions. But you can only ask the right questions when you have a different perspective. But you've been drilled since you were little to have that kind of perspective. So, yeah, I'd love to do a debate. But see, they never take me up. And the TV has never let me go live. Do you understand? I've turned down every station, even this year, because they will not give me a live segment. They always want to cut it. Give me a live segment. Put Purveyor, put Aurora, put all their top docs or immunologists, and listen, let's debate on TV. I welcome it. You understand? But they won't do it. They want to do a tape session so they can edit stuff that way. That's why I will never do something that's on TV that's not live. So that's why this is live. It really is. So these questions come in that way. We're not editing them that way. So, all right. We got time for a couple more questions.
Perfect. So I think most of us know the answer to this one already, but Nicole, did you get the COVID vaccine? Being a medical professional.
No. No, I will never, ever get the COVID vaccine. In fact, I fought and wrote letters and tried to prevent my other colleagues from having to get one as well. And so no, never.
Awesome.
And then, Doc, I have one for you as well. It says, Dr. Flynn, my sister swears by you, and she seems so happy and healthy. She's lost a bunch of weight, and she's off all her meds, and she tells me you're a chiropractor. How is this possible? ... You push on backs?
No, but
That's
see,
great.
Yeah,
I love it.
No, but see, here's what happens, and I will be very clear about this, and I will probably never be allowed to speak at their colleges again, but the chiropractic colleges are just a subset of medicine now. Chiropractic colleges started out as an opposition to the stupidity. Remember when Rockefellers got big into medicine, people realized Rockefellers created the medical schools because they could do petroleum-based drugs that way, and you look at the history of it, that's medicine. Sad part is this, chiropractors used to be actually doctors that always focused on physiology, neurology, all the things that happen. That's why they were always the doctors that were opposition to all this stuff, and they were what we did today. But because of insurance, money, want to be accepted, I think we can tell, I don't give a shit if people like me or accept me. You understand? Because the public accepts us because you know why? Because we get the clinical results and nobody else does. So chiropractic's history was always based on being that carpenter type doctor. Looking from, so what they did is they tried to pigeonhole like they've done every, osteopaths started out as a health kind of doctor and they got manipulated into what they do today. See, so what happens, chiropractic is the same thing. I looked at our history and looked at our stuff and basically said, no, their perspective was great. Then I took the clinical model and advanced it that no chiropractor has done in history. Because I just said, and that's why even medical people goes, man, where'd you come up with this? Well, really it came from our philosophical premises to where chiropractic really started. It really did. So actually chiropractors are actually the real doctors.
So chiropractic philosophy, I know I'm not a chiropractor, but I wish I was. So chiropractic philosophy is based on the foundation of inflammation arises from the 3 T's. Trauma, toxins, and thoughts. And the pushing on the back is addressing the trauma. But then addressing the toxins and the thoughts, that's what Dr. Flynn has been able to figure out, how to test properly, how to support the body, and how to remove that inflammation from the body. So truthfully, the wellness way approach is what chiropractic was always meant to be, but now it's all that it's becoming is pain clinics. You know, you get into an accident and you go to a chiropractor to fix your back. And so that's where, you know, truthfully, like I feel like I'm the chiropractor that got away.
Yeah, you are.
I can't address the trauma.
You're an honorary one.
I'm an honorary chiropractor, and so that's where I just had to. I had to like elevate you a little bit. That's how it was.
Well, no, but see, I want to do this. I want to elevate our profession the way it was supposed to be. See, so I tell people, I'm proud to be a chiropractor. I'm sorry that our whole profession, even in Durham, in our schools, Palmer, Life, Northwestern, y'all suck. Y'all suck. You do. You're just charging $300,000 to be them nothing more than a pain doctor, which most of your pain, doesn't come from your back. It doesn't. You understand? I can tell you right now, like I said, when you look at most people, they're so toxic and they're so stressed out. Structurally, you only have so much pain based on that. Here, watch this. How many guys get adjusted on a regular basis and still have pain? Look at even the interns are raising. Do you understand? See what happens because that's one thing, and so they pigeonholed into that way. I said no. I knew because the thinking, the philosophy. So there is the medical thinking and there's our thinking. So I built the whole care around our thinking. And sorry, most chiropractors don't do it, and so they fail in practice. They don't succeed. They don't get to see the results we do, and I wish they did. And so I'm at just a stage of my career now is to elevate the profession. So if I push on your back and something changes, it's because that was one of the stressors, but it's not the only stressor.
Helps the body to adapt.
Yep, that's it.
But you can't adjust out a mold toxicity.
Nope, and you can't adjust out a mental stress. So that's
where you have to have the full trauma, toxin, thoughts.
And so what I did, I sat back as a student. I sat back early in practice, said, what if I could, instead of testing for fires, go back to my analogy, fireman, carpenter, if I started to test what each body needed and what was stressing out, what was triggering fires, stuff like that, and started to rebuild. And I just sat there and did it as a young kid from 24 years on, well, actually before that in school, and that's what we have today. And it's gonna continue to go. And see, medicine, just like they've done their whole career, they tried to suppress, they threw good chiropractors in the 50s and 60s and 40s in jail for actually doing what was right. And that's why all these chiropractors say, and so, sorry, chiropractic schools, remember, I'm supposed to be speaking at schools who will probably not let me do that. We stand up for what, we'll go to jail for chiropractic. you threw a mask on all your kids. Sorry, President of Life, Palmer, Florida, Northwestern, all you guys that threw masks on kids. You guys are a disappointment to our profession. Very disappointed that you masked all these interns and all these kids and stuff like that. You know what I'm saying? Here, every office I owned, regardless, it was mandatory. I'm like, no, you don't mask that. You actually tell them to piss off. You tell the government to piss off. You have your rights and stuff like that. So my little soapbox on there, but I'm like, just like I said, that's why everybody's like, look at the CDC reverse their things now. Yeah, and you sat there and cowered to it because you didn't stand up for what was right. So don't tell me you have morals and principles and stuff like that when you cower during time that way. So my feelings on the schools, so guess what happens? I actually got sick of the schools. We started our own.
We did.
We started our own because education is nothing more than a learning process. And our academy does so well. And maybe one day we'll have a bigger thing to be turned into a physical school. Who knows? Yeah. Wellness Way Academy may turn into...
Wellness Way Academy, our next session starts tomorrow.
Mm-hmm. We have a ton of people, and we have a ton of medical people in there. Do you understand?
We do.
It's like, it's exciting, but that's what happens when I said, I don't need the schools. Do you understand? Actually, the schools are just giving you a huge, here, watch this. Students, you get $10,000 off your student loans, which we'll all pay for people that pay your taxes. But anyways, this is like, wow, they already charge you $300,000. Good, you get to eat for one more week. You know what I'm saying? So it's kind of nice. So, all right, might be a good time to end on that question and stuff like that. So, Dr. Jenny, thank you.
Mm-hmm. Thank you.
Nicole, thank you as always that way. So, Travis, let's start to move into our product highlights of today. All right, as all you guys continue to ask us about some of the things, you saw the quality that we did last week. But remember, each one of our herbs have and each one of the products, even if it's not an herb, it might be just an individual mineral like magnesium stuff. They have a specific physiological response that we're trying to accomplish on all the things that we even talked about in our questions today. One that I want you guys to know, because it's coming up a lot, is actually something called dandelion root. Okay, I love this. We're going to talk a little about the major function it does, but once again, it has liver function support, diuretic, combats free radicals, helps allergies and skin conditions. Now, once again, when you see that, that's actually put like in more of a medical perspective. But I want to show you the major thing that I like about it, because here's what happens. The #1 surgery out there today is gallbladder surgery. Gallbladder surgery. Dandelion would probably be the greatest prevention when it comes to gallbladder problems that way. The dandelion root itself. Now let me go back. Say, Doc, are you talking dandelion like the yellow flowers outside our door? Yes. Dandelions are fantastic. I love how they act like it's a weed and it's bad. No, those things are so nutritious. You can actually really, pop them off your ground and throw them in your salad, and they're actually good for you. They really are. But dandelion root itself, once again, has a major property of stimulating the excretion and release of bile. And bile is majorly used for fat absorption because it emulsifies that way. But bile, actually, people don't realize, has some toxins in there. It really does. So that's why when bile is released, what it does now, it actually goes into GI. It does help emulsify fats, but also pulls some of the toxicity out of our liver. That's why you see some liver support for it that way. But it's one of the easiest ways to stimulate the release of bile from the gallbladder. So therefore, you can excrete the gallbladder, get all the stuff out. So that's why when people have, bile stasis, which can lead to gallstones, which once again is still the #1 surgery. They're still the #1 surgery by far as gallbladder. So dandelion root is extremely important to allow the system to actually stimulate, excrete more bile. And that's why a lot of times when you take it, you can actually get a significant amount of bowel movements right away, because you can cause a massive release of bile. And guess what happens? Like I said, bile being in the intestinal tract is like creating a slip and slide. You understand? It just comes shooting out. You understand? And so therefore, when you actually take dandelion root, it's going to pull some of the toxicity out of the liver. It's going to move the bile from the gallbladder into the system that way. And it's going to actually, if you have any minor stones going on, guess what happens? And it's very common for this to happen, especially in low-fat diets. So dandelion root, when people come in, they say, Doc, I'm on a low-fat diet because my doctor said fat's bad for my heart disease that way. I'm like, ooh, man, you got to be careful, because your gallbladder is going to have some stasis in there, and you have more chance of building up a stone. And therefore, with the #1 surgery, I personally believe, and it's my opinion, I personally believe if people actually took dandelion root every once in a while, they would have less of effect of ever having a gallstone. And on top of it, when people did have gallstones, what I did is say, listen, it may hurt a little bit too, but I'm going to give you a ton of dandelion root. And what it did, it caused the release of the bile, which caused gallbladder contraction. If there's some stones, sometimes it'll hurt. And therefore, we got them out before they got large enough to where they couldn't be removed that way and they had to be removed surgically. So that's why I love dandelion root for multiple purposes. But there's also some other great research. Once again, as we tell you, there's so much good research about products out there, but I want to show you if you look at this way. It's quite simple. The diverse biological activities of dandelion. Yes, and I just put the articles out there because I always like to back everything we do, because when people always give me opinions and say, okay, where'd you read that? Can I have a copy? And you guys know I read journals every single day. I subscribe to a lot of journals. Actually, Dr. David and I, I got him now, helping me as a right-hand man here, and I'm teaching him how to get the journals and how to look for stuff, because medical science and medical practice never does match up. That's in a journal. Do you see? I'm pointing to the screen over here. That's in a journal. Yeah, when was the last time that a person actually may have had some small gallstones and went into the general practitioner and said, hey, listen, we're going to actually give you some dandelion root so we don't have to end up in surgery. And you say, and that could actually be done. But that's not part of their world. Even though there's a ton of research on this stuff, they actually is not put into clinical practice because they just wait for the surgery. And guess what? But the bad part is, without a gallbladder, you have more chance of having taken some form of supplement or bile the rest of your life, because you don't have a gallbladder, it doesn't know when to release. So, love the product. If you do have even some minor gallstones right now, or concerned about gallbladder, having some gallbladder issues that way, get some dandelion root, start it, and actually start slowly and build up from there. And then you'll know you've taken too much when you actually get some very big slip inside with some diarrhea. So let's move into my last 10%. My final thoughts and last 10% is what we have transpired and what Nicole and I did. And like she said, we predicted so many things that were going to come about. If you go back to our YouTube channel or on the website, if you're on right now, go to our videos that way. But the reason why we got to predict so many things, because this has been medical behavior since the 20s and 30s. They've been trying to dominate, control, manipulate, lie, everything. That's why I know a very nice guy that's a medical doctor, Purveyor, great guy, but he drinks the Kool-Aid, and he believes the same stupid stuff and that every other doc does, and he's a nice guy. He's actually even a really great guy, actually, and stuff like that, but they're so programmed. But see, it's really interesting, because now, as you can see from the slide here, guess what? Wow, see, he completely reversed his course. You know what's really funny? I mean sincerely, when you're in a position of authority, especially when to force something that way, guess what happens? You don't have the right to just say, did you change course, without somebody going to jail. You say, you think I'm joking? These people should be held accountable. They forced people. The people lost their jobs. People are damaged. And guess what happens? Oops, we changed our course. We're changing everything we thought about the vaccine and everything like that. No. And then Fauci wants to actually get a huge retirement package. I have a retirement package for him. You can put him into a solitary confinement and give him 3 meals a day for the rest of his life till he passes away. You saying, there's your retirement plan, because that's where he belongs. He's got kickbacks. When are we going to finally say enough is enough with all this crap going on? And you just sitting going, hey, it's over, everything's cool, I got to take off my mask. You're part of the problem. Do you say, why are we the only ones fighting for your rights? Get your butt off the couch. I hope Packers win the Super Bowl, but guess what happens? You spend 3 hours watching the Packer game and you don't fighting for your rights, it's coming around again. Do you say, and so you need to do things and get your butt in gear to actually step on. And now's when you don't back off. Now's when you go for the actually true things that can be done that way. You say, support a politician that's going to go after these people that way. They're going to hold them accountable. Support Ron Johnson. No joke. Ron Johnson at least is going after these people, want to bring them from the Congress, want to bring them from the Senate, and hold them accountable that way. And if you're in a Democratic state that doesn't want to do that, guess what happens? Replace those people. We're hoping in November that a lot of these people get replaced, because they hurt you guys. They hurt people. They don't get a free pass. The number one, they should be fired, but they should be jailed. There was a Nuremberg Code for a reason. These doctors actually knowingly did this stuff. And you think that they didn't know? We're just following orders. Ask those people that actually went to jail because of that way. It's time for this to happen. It really is. Because once again, if we don't hold them accountable in a legal format and actually holding them, just because your life went back normal because you got to take off a mask, if you actually back down, guess what's going to happen? They're going to do it all over again, just in a different way. Do you think that this fall that they're not going to try to push the flu vaccine and push for their narrative that way and stuff? This is a time that you guys got to learn and move forward in order to actually do what's right. I'm saying, you guys were scared before when the government was pushing stuff. Now they're backing off. Now what happens is, now you don't back off. Now you go forward. Now you march forward on this way. Call for their jobs. Get them fired. Get them out of that place that way. Put people in there that actually will fight for your freedoms and fight for your rights and do what's right. Because government organizations shouldn't have any power of the people. They're there to protect people. You understand? Not force people to do anything that way. The CDC should be dismantled in the first place. CDC, FDA, all those things should not exist in the first place that way. They were never voted for. Nobody voted for Fauci. Nobody voted for a CDC president. Nobody voted for the FDA president. Nobody voted for all those people. And look what they're doing. They're using things like the FBI to do their dirty work that way. And go on. They showed up at my house too. You understand? It's time to push back a little bit that way and get these people out of power and put the right people in place. So last 10% should be, guess what happens? Should be 100% moving forward and say, listen, put good people in place that know what they're doing. I'm going to support Ron Johnson. I hope he continues to push, and all his people across the country that need to put people in good positions to actually fight for your rights. Because if you don't, guys, it's coming around again. It's coming around again. You understand? And people say, well, no, everything went back to normal, we're fine. It didn't go back to normal. Do you know why? Because Pfizer still got $48 billion quarter profit from COVID stuff. You understand? That money should be not only given back, they should be shut down as a company. You understand? That's what happens. They perpetuated all these problems. They've all been sued for malpractice and all the bad things they've done. Look at their history that way. But we have the ability to stand up and do what's right. So don't fall into the trap that now that they're reversed, because people are like, oh my goodness, look at what are you going to do? No, what are we going to do? We need to actually step up, do what's right, put good people in place so this stuff doesn't happen again. Because remember, when good people do nothing, evil prevails. And if you consider yourself a reasonable, good person, and you sit around and do nothing besides watch a Packer game and you think you're contributing to the world, you're actually part of the problem. You know what I'm saying? I fought, I got criticized, Nicole got death threats, FBI showed up at her house, we all these things that way, because we went back down in the mix of things. And we still don't back down. But it's time for you guys that did nothing, and that's the majority of you. It really is. It's a majority of you. It's a majority of people out there in public that did nothing, and that's why it went on so long. But see, now what happens is things are being uncovered because of people like us and our people that kept on fighting, kept on pushing against it, and they can't hide behind it. But now, guess what happens? Don't go back to your normal lives. Because if you don't fight now, there will be no good normal in the future for you guys. So I promise you this, we will always fight financially, politically, things like that, and get right people in place. We'll always follow the laws and do what's right. We'll be ethical through the process, but we won't back down. You understand? If there's a bad politician in Wisconsin, we will make flyers, we'll go door to door, we'll do everything in to get that person out of power, because they shouldn't have control over you or us. Because I don't care what your beliefs in Republican or Democrats, even though we know Democrats have lost their freaking mind, especially the president. Well, he doesn't even have a mind, you understand? But the idea is this, is who should make the healthcare decisions for you and your family? A politician, the government, or you? See, it doesn't matter what your political affiliation, you always see you. Then why would you ever put somebody in power that actually would want to control what you do? Because you know why? Look what happened. Get those people out. So, that being said, guys, hope you guys have a wonderful day. It's an exciting day for us that way. Once again, happy birthday, Mom. We'll see you guys later. And my name is Dr. Patrick Flynn. Thank you, Nicole. Thank you, Hunter. Thank you, Devin. Thank you, all you guys, all you interns, all the people behind the scenes that way, for just another wonderful show. And we'll bring you some amazing stuff on cholesterol next week and show you how the medical field has lost their freaking mind and trying to tell you that cholesterol has anything to do with heart disease. We'll see you next week. Thank you for watching. Make sure to subscribe to this channel so you don't miss a single video or live stream. Each week, on a different perspective, we bring you the most cutting-edge information on health you won't find anywhere else. For more information on this topic, please visit our website. A Different Perspective offers life-changing information and resources to share and explore. A Different Perspective is leading a health revolution.